Sakthi Dental Clinic, Mullukurichi. Ankylosis refers to the abnormal fusion or immobility of a joint, resulting in a loss of its normal range of motion. It can occur in any joint in the body, but it is most commonly associated with the joints of the spine, such as the vertebrae, as well as the temporomandibular joint, TMJ, in the jaw. There are different types of ankylosis, including fibrous ankylosis, bony ankylosis, and true ankylosis. Fibrous ankylosis. This occurs when the joint is immobilized by the formation of fibrous connective tissue, which limits the movement of the joint. It often results from chronic inflammation, injury, or infection. Bony ankylosis. In this type, the joint is fused together by the formation of new bone. It typically occurs as a result of trauma, fractures, or joint infections. True ankylosis. True ankylosis refers to a combination of fibrous and bony ankylosis, where both connective tissue and bone formation contribute to the fusion of the joint. Ankylosis can have various causes, including trauma, joint injuries, fractures, or dislocations can lead to ankylosis if the healing process results in abnormal bone or tissue formation. Infection. Chronic infections, such as tuberculosis, osteomyelitis, or septic arthritis, can cause inflammation and subsequent joint fusion. Rheumatic conditions. Certain autoimmune diseases, such as rheumatoid arthritis and ankylosing spondylitis, can lead to joint inflammation and ankylosis. Genetic factors. Some genetic conditions, like congenital joint disorders, can predispose individuals to ankylosis. Joint diseases. Chronic joint diseases, such as osteoarthritis, can contribute to the development of ankylosis over time. The symptoms of ankylosis depend on the joint affected and the underlying cause. Common signs and symptoms may include limited range of motion in the affected joint, stiffness and pain in the joint, particularly during movement, swelling, tenderness, and inflammation around the joint, muscle weakness or atrophy due to lack of use. The treatment options for ankylosis depend on the severity, location, and underlying cause of the condition. In some cases, conservative measures such as physical therapy, pain management, and assistive devices, such as braces or splints, may be used to manage symptoms and improve function. Surgical intervention, including joint manipulation, joint replacement, or joint fusion surgery, may be considered in more severe cases or when conservative treatments are ineffective. If you suspect you have ankylosis or are experiencing joint stiffness and limited mobility, it is important to consult a healthcare professional for a proper diagnosis and appropriate treatment options tailored to your specific condition. Thanks for watching. Like and subscribe.